Hey everyone, I know that each and every one of you wants to be really good at taking exceptional radiographs on your patients, and each one of you is perfectly capable of doing so. You have to understand quite a bit of science in order to really get good at radiology. You have to understand everything that's going on in that tube head to create the radiation. What are the electrons doing? But in today's episode, we're going to specifically talk about density and how density plays a role in your imaging. And this is really important. There's a huge amount of variation in all of the objects inside the mouth, and you need to have a really good understanding of how that relates to your image and how what's going on in the tube head also impacts the density of your image and the quality of the outcome that you're hoping to achieve. I hope that by the end of this episode, you'll have a good understanding of what density is, how that relates to radiology, and your image quality as a clinician. Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. Talking about density, I want you guys to just think real basic terms before we dive into this. Think about high school or even elementary school science. You did density tests, I'm sure of it, when you were in your science classes. And the teacher probably presented you with objects and you had to figure out if they would float in water or sink in water. Now think about those objects if they float versus if they sink. It's not just based on weight. It's also due to the density of that object. Now, something heavy, like a piece of wood, I would think that a piece of wood would sink in water. But quite the contrary. When you put a piece of wood in water, it actually floats. And the reason why this happens is because the wood is less dense than the water. Now, if you throw a rock or a pebble into the water, the rock is going to sink to the bottom of the lake. And the reason why this is not because of the size of the rock, it's because of the density of the rock. The rock is going to sink to the bottom of the lake because it's more dense than the water. So density is not just about size, it's about how solid something is. Now, remember back to your elementary school years that there's molecules that make up everything, and that density is based on how close those molecules are to one another. So something that's more solid has molecules that are closer together, and something that is less solid has molecules that are further away from one another. So how does this relate to the significance and importance of your radiographic images? When we're looking at radiographic density, we're looking at the amount of darkening or the degree of darkening on a radiographic image. And this is specifically due to the density of the object that you are trying to obtain an image of. All right, so I want you to think about a balloon. If you fill a balloon with air, the molecules inside that balloon are further apart. So radiation can penetrate that balloon pretty easily, right? Air is the most radiolucent image that we take. And then if we filled that balloon with water and made it into a water balloon, That water balloon, if you took radiation and went through the water balloon, it's a little more dense than the balloon that is filled with air. So there are 5 objects that we take images of when we are using radiology in the dental setting, and each of those objects has a different level of density. So think about this. So the air would be the most radiolucent of all of the objects that we take images of, right? And you'll see this on your radiographic image wherever there is nothing present in the mouth. Then you have fat, right? So we're going through fatty tissue when we are taking an image of our patient. And then you have water, that's kind of in the middle, right? So if you're doing those science experiments back in elementary school, the water is the middle of the densities, and there's things that are less dense than water and more dense than water. So the next more dense item is bone, and you take lots of images of bone. These are the things that we see on our radiographic images. And inside the bone are different items like the pulp and the nerve chamber. You'll see the pulp chamber, the nerve canals, you'll see the periodontal ligament fibers that go around. All of these show up as having a different level of density on those images. And then the most dense item that we take a radiographic image of is metal. Now think about your metal restorations. The molecules on those metal restorations are really close together. So those are the most dense items that you are trying to take an image of. So the radiation cannot penetrate the metal. It is the most dense item that you take images of. So let's talk about how that relates to what the image actually reveals. So the more dense something is, the less likely the radiation can penetrate it. So if you picture that you've got your tube head and it's pointed towards the patient's cheek, which is made up of fat and muscle, right? But you have some air in there. So you have air, and then you have the patient's cheek, which is fat and muscle, and there's probably some water in there as well. And then inside the cheek is the bone, which may contain some metal. And then on the inside of the arch is the sensor. When you take an image of a patient's, maybe you're doing the posterior bite wing, the radiation comes through the PID, through the air, through the cheek, through the bone and metal, and onto the sensor. Now think about what that image shows up on the screen as. So now you're looking at the screen and you're seeing this image and you're seeing all kinds of different gray scales. You're seeing lights, you're seeing darks, you're seeing blacks, you're seeing whites, all on this one radiographic image. All of those things are indicative of the density of the items that you are trying to take an image of. So think about this. If the radiation cannot penetrate the metal, that means the radiation is not getting through the metal, so that is going to show up as white. The more easily the radiation can get through the object because of the density, the darker it's going to show up on the sensor. So places where there is nothing except air are going to be very, very dark on your radiographic image. And things where there's bone are going to be lighter. They're not going to be as dark because less radiation can get through that bone because of the density. The metal will not allow the radiation to penetrate through, so it does not reach the sensor. So that is why that shows up as white. Okay, so think about your whole grayscale. And when you're looking at a radiographic image, rather than looking at your overlap and your cone cut and did you place the sensor correctly, I want you to just take a moment to really think about the science behind the image, the density that's involved with how that image shows up on the sensor. There are so many different levels of density being displayed on that one image, especially when you have a patient who maybe has a ceramic crown and a gold crown. Those are going to show up differently because ceramic is a different density than gold. So I want you to just take a moment and pause. Look at your radiograph. Look at that image with a completely different perspective, only considering the density of the objects that you are trying to take an image of. And then relate that back to radiographic density and how the density of things causes that image to have a different color view scale. The grayscale is different on that sensor as a result of the density of the object that you are trying to take an image of. Now, the inverse square law, the intensity of the beam varies inversely with the square of the target distance. So the target, right? So the teeth that you're trying to get an image of, the distance to the receptor. These are important configurations when you are taking an image of a patient's tooth. There's KV and MA. The KV controls the quality of the penetrating power of the X-ray, and this affects the density. The MA controls the quantity of the number of X-rays. So if you change the MA, you'll change the number of X-rays produced, which will also change the density. When the target to the receptor distance is doubled, the original exposure time should be multiplied by 4. So it's important for you to know the size of the PID that you are using when you are taking an image on a patient. When the target to receptor distance is halved, the original exposure time should be divided by 4. So the opposite is true. It's really good for you to know this. So think about this as well. Each 15 kV increases the number of X-rays. The exposure time must be decreased in order for you to maintain the original sensor density, the original image density. Each 15 kV decrease reduces the number of X-rays, and as a result, your exposure time must be increased in order for you to maintain the original density. Keep in mind that the MA, the milliamperage setting, controls the amount of current that will flow through the filament in the cathode. Remember the number of electrons and the current. The higher the MA setting, the higher the filament temperature and the greater the number of electrons are produced. These are all factors that you need to consider when you are taking an image and looking at the density of the item that you are taking an image of. So the key points I want you to remember is that the density shows up as the darkness or lightness of an image on your sensor. It's influenced by the KV, the MA, and the source distance. It's also influenced by what you're taking an image of. The most radiolucent item would be air, and the most radio-opaque item would be a metal. This is density in a nutshell. This is radiology density so that you can understand adjustments that might need to be made in order for you to achieve the best image for your patient. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.